Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about prostatitis. This was actually a requested video, so thank you to the person who requested it. If you have a video request, go ahead and leave it in the comments below. So let's get started. Well, what is it? First of all, it's inflammation of the prostate gland. And there are two main types. There's acute and chronic. The acute kind is pretty rare, which is a good thing because it's more dangerous. So the acute kind has a sudden onset. It is usually a result of bacteria, but it's pretty rare. And that's a good thing because this one can become quite life-threatening if left untreated. The chronic kind is the most common kind. It lasts for several months. And sometimes they don't know the cause, and then sometimes they think the cause is related to nerve damage. So we're not thinking bacteria when we're thinking chronic. We're thinking we're not quite sure what the cause is, or it could be related to recent trauma due to surgery or an injury to the nerve. So that's the chronic kind, that's the most common kind. Who is at risk for developing this? People who are in middle age, have had a recent or current bladder infection, have HIV or other STIs. There's pelvic trauma caused by horseback riding or bicycle riding. They've recently had a urinary catheter, an indwelling Foley catheter. They engage in anal intercourse, or they've recently had a prostate biopsy, again related to potential damage from that. Now let's talk about the signs and symptoms. When it comes to signs and symptoms, the patient could report painful, frequent urination, dribbling, hesitancy, nocturia, which is getting up in the middle of the night to urinate. They might think that their urine appears cloudy or that there might be blood in their urine. If they have the acute kind, which is caused by a bacteria, they can have flu-like symptoms, including a high fever. They might also report pain with ejaculation or pain in their abdomen, groin, lower back, testicles, or penis. So how is this diagnosed? Well, they're going to do a couple of different things. They're going to do a digital rectal exam. They'll probably end up doing a UA, especially if we're looking for blood or presence of white blood cells in the urine. They might do other blood tests to see if this was caused by a bacterial infection. They'll probably do something called prostatic massage, which is kind of part of the rectal exam. And what they're going to do is they're going to get some secretions, and then they're going to test those secretions. That's the point of that. And then they may also want to do a transrectal ultrasound so they can get a visualization of what's going on internally. So now that we know about that, let's talk about treatment. Some treatment options you might see your patients get can include things like antibiotics, especially if it's the acute form, anti-inflammatory medications to help reduce swelling and inflammation, alpha blockers, which relax the bladder, which can help with some of those signs and symptoms like the painful, frequent urination. We can offer them a sitz bath. Good teaching about the diet. So you want them to limit or completely avoid things like alcohol, caffeine, and spicy foods because those irritate your bladder. Avoid prolonged sitting or bicycle riding. If necessary, if they're reporting pain with defecation because of this, you can instruct them to use things like stool softeners or laxatives as needed. And then drink lots and lots of fluids, lots of things like water, not caffeinated beverages or alcoholic beverages. Some potential complications that can occur. Bacteremia, this is when the infection, the bacterial infection spreads and it goes into the bloodstream. We don't want that. They can have an abscess, and then they might even become infertile, or there might be a change in their semen that can cause infertility later on. When it comes to prevention, the first line is to avoid getting an infection in the first place, right? And if that's not the case, if you have a UTI, maybe you've had an indwelling catheter for a long period of time and you've got a UTI, we want to treat that right away so it doesn't spread and it doesn't get worse. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.